Uh, my name is J.R. Godwin. We're Group 2. We're doing diabetes. My partners are Laura Espinoza, Daniel Garcia, Grant Lyles, and Jordan Parker. Today we're discussing the effects exercise have on diabetes. Now, the diabetes itself is a problem with insulin. Type 1 diabetes is the body's ability to not be able to produce any insulin. Therefore, you cannot absorb the glucose into the cell. We won't be talking about type 1 diabetes because it's highly genetic, and so exercise does not have much of an effect on this disease. Type 2 diabetes, on the other hand, is over time with abuse and a sedentary lifestyle, especially with diet as well, your body will start to have insulin resistance and a decrease in insulin sensitivity. With these, your body's not going to be able to take in the glucose into the cell, sometimes not at all. And exercise has been shown to possibly increase that resistance, or decrease that resistance and increase that sensitivity. Possible causes for type 2 diabetes are one is poor diet. After a long time of eating foods that are unhealthy or high in carbohydrates and fat and simple sugars, your body will start to, if you use it long enough, and eventually it starts to quit on you, and you'll have these issues arise. A sedentary lifestyle, especially this, along with a poor diet, will cause this to happen as well. But there is possible genetic reasons. If there is type 2 diabetes in your family, you're more highly susceptible to have these type 2 diabetes issues. Certain environmental factors as well. Complications with type 2 diabetes and why it's so important that we do, if there is exercise does help, that we do address this, is not only with just the insulin and the glucose absorption, but there's also neurological issues, also heart disease such as congestive heart failure can become an issue, problems with the limbs, the hands, especially the feet. It's very, very common for people with diabetes to have issues with their feet, especially even leading to possible amputations. Kidney disease, eye damage over time, the eyes will deteriorate and you'll start to have very high corrective lenses. And also hearing can start to diminish over time with diabetes. Benefits of exercise. With this exercise, you will have an increase in insulin sensitivity and a decrease in the resistance of insulin. Possibly, most of this is due possibly to GLUT4, which is produced during exercise, which works like insulin during exercise to absorb glucose into the cell. And also after exercise, your body is kind of hungry for carbohydrates and hungry for glucose, and so your body is more primed to bring that glucose into the cell along with this GLUT4 adaptation. This is just a chart kind of showing how glucose is absorbed in a healthy individual. You don't see a problem here. The insulin binds to the receptor, opens up, you get the glucose in, the GLUT4 is present as well. In type 1 diabetes, you will not produce any insulin from the pancreas, and without insulin, glucose cannot be absorbed. With type 2 diabetes, you'll have a resistance to this, where your body will produce insulin, but it may not be able to accept that. The receptor, the insulin receptor, cannot accept the insulin, and because of this, you will have a hard time bringing the glucose into the cell.
All right, so the first study that we'll present to you is to see the effects of exercise on type 2 diabetes, and more specifically on the Latino men and women that have type 2 diabetes. And this research was constructed by the names on the screen. So how was this research designed? It was a 16-week high-intensity progressive training with Latino men and women that were of the age 55 or older and were tested and confirmed to have type 2 diabetes. Each subject would, for each session, come in and exercise 3 times per week for this total of 16 weeks. And each session was approximately about 50 minutes, which was constructed to begin with a 5-minute warm-up. Also, It was followed by 35 minutes of exercise, which was mostly done with resistance training machines. And then that was, the exercise ended with a 5-minute cool down, which ultimately consisted of stretching. And each exercise was consisted of 3 sets of 8 repetitions. Each subject was confirmed with a 1 rep max, and for weeks 1 through 8, each subject performed at 60 to 80% of their 1 rep max. And since this was a progressive training program, weeks 9 and 15, each subject performed about 10% lower than their current workload. And this was to ultimately minimize injury and to minimize overtraining. And then finally, for weeks 10 through 14, each subject performed about 70 to 80% of their 1 rep max. Also moving to the results, as anyone could imagine, there was an increase in lean body mass. But more interesting, there was a 72% of the participants reduced their diabetic medications. And also on the screen you'll see in table 2 that there was a drop or a reduction in plasma glycosylated hemoglobin concentrations and also in the fasting plasma glucose concentrations. And these are ultimately, doctors will use these measurements to diagnose patients with type 2 diabetes. And also there was an increase in the muscle glycogen stores, which ultimately improves glycogenesis. And the plasma glycosylated hemoglobin concentrations were determined by the GlyTest2 assay, and also the fasting plasma glucose concentrations were analyzed by hexokinase enzymatic analysis and also spectrophotometric analysis. And the muscle glycogen stores were also analyzed and determined by the same procedures as fasting plasma glucose concentrations. So what did the researchers conclude of this study? They determined or concluded that high-intensity progressive resistance training is effective in the management of diabetes. And this is ultimately done by 2 factors, which for one include improved glycemic control. And this is ultimately so that blood glucose levels are improved with resistance training. And then second, by improved metabolic control, which can affect glucose intolerance, hyperinsulinemia, and hypertension. And now we'll move to our second study, which Jordan will present to you.
All right, so our second study goes over an 8-week study of the effects of aerobic exercise on type 2 diabetes in males. So what this concluded in the overall study was that chronic aerobic exercise can decrease the insulin resistance in people, which ultimately will decrease type 2 diabetes, because that's basically what type 2 diabetes is, via increasing the plasma levels of orexin A and decreasing plasma levels of glucose and insulin. Of course, done by the following people below what I just stated. So the overall design of this study were that 20 male subjects were chosen with type 2 diabetes, ultimately of an age range of 40 to 50, so they were in their middle ages, which is really common for type 2 diabetes. The groups were randomly assigned into a control group and an experimental group with 10 people in each group, so it was evenly divided up. The inclusion criteria for this study was that their blood sugar had to be between 126 and 200 milligrams per deciliter. They would have to have, acquired diabetes or type 2 diabetes within the past 5 years, so pretty recently. They also can't have a smoking habit, a drug addiction, or be on any sort of medication. They can't have any kind of particular disease pertaining to cardiovascular disease, renal disease, hypertension, or respiratory diseases. They must not be an insulin user. And they can't have any diabetic complications such as diabetic foot sores or peripheral vascular disease. There was an exercise protocol for this study that required each participant to participate in a 15 to 30 minute exercise per day. And so in the earlier weeks of this 8-week study, it started with a 50% increase or a 50%, they exercised at 50% of their heart rate max for 15 minutes a day. And then as the study continued, they increased what they were doing with their heart rate max to 80% of their max heart rate. And in 30 minutes, it took them 30 minutes per day during the last week. In order to measure their heart rate, a heart rate monitor was used, and there were no nutritional changes in the subjects, which, would be necessary because nutritional changes can also change hormone levels, which we wouldn't want in a type 2 diabetic study. Also, blood samples were taken from both groups. The blood samples were taken right before the study and 48 hours after the study was completed in each individual. So the results for the study, in Table 1 for the physical and physiological composition of each subject, in the experimental group, you can see there is a significant reduction in weight. So in your control, in your weight, before it showed about a 79, and then afterwards it was 79 again, not a big decimal change. But in your experimental group, it went from 82 down to 78. And also, there was a significant increase in VO2, which we would expect with aerobic exercise. So in your control group, it went from 35 again to a small decimal increase in 35. But in your experimental group, it went from 37 to 41. Also, there were no significant changes in other indexes in both groups. But in Table 2, it demonstrated the plasma levels of OXA, leptin, glucose, insulin, and insulin resistance before and after chronic aerobic activity in control and experimental groups. So what we see in this table is that there was an increase in OXA, as you can see, circled in blue. In the control group, it went from 50 to 51, but in the experimental group, it went from 52 to 55. And there was also, as you see, everything circled in red had a decrease. So what decreased in this were glucose, insulin, insulin resistance, and leptin. So the conclusions for the study of aerobic exercise on type 2 diabetics is that aerobic exercise increases glucose uptake and reduces insulin resistance with key signaling proteins such as AMPK, which will regulate glucose uptake in skeletal muscle, which allows the glucose to be used as ATP in order to power the muscles. Also, chronic aerobic activity increases the plasma levels of OXA, which we saw in the table previous to this slide. OXA also increased glucose uptake with GLUT4. Furthermore, OXA resists diet-induced obesity and decreases insulin sensitivity by improving leptin sensitivity. So overall, exercise can also increase metabolic thermogenesis and prevent weight gain and metabolic disorders such as type 2 diabetes. So aerobic exercise reduces leptin through decreased body fat levels, so losing weight, and negative energy balance. And it can increase catecholamines and decrease insulin. Research also suggested that the reduction in leptin secretion is due to an increase in plasma levels of OXA. And now we will look at Study 3 with Laura.
So I did my research article over a short
short span research. So I did it over the effect of 7 days of exercise training and insulin sensitivity responsive on type 2 diabetes. And pretty much what the overall takeaway from the article was that there was an improvement in insulin and action induced by short-term exercising training on patients with type 2 diabetes. And that also caused an increase in insulin sensitivity and responsiveness, which is what we want to see in the body. Okay, and so for the study, since it was only 7 days, there weren't too many requirements needed from the patients. We had 14 overweight or obese diabetic volunteers, and it's not listed on here, but 11 of them were men and 3 of them were women. Men seem to be affected more by diabetes than women do, so in this specific study, it was kind of more targeted towards men. And the only real requirement prior to the study was that they kind of log in their food and really pay attention to what they eat, just to make sure that they were taking enough calories and protein and stuff in, just to make sure that they could do the study. And so it was broken down into their diet should have been 50% carbohydrates, 35% fat, and 15% protein. And then once the study actually started, all they were required to do was to have 50 to 60 minutes of exercise on the treadmill, walking, and that could have also been on a stationary bike. Those are pretty easy to access at any gym, and so this study was specifically targeted so that a majority of the population could do it. And the way that they set up their results, or what they based them off of, were insulin. They had this plant that also had glucose in it, and they would infuse the patients with them to make sure they had a starting metabolic rate. And then afterwards, after they exercised for the 50 to 60 minutes, they would then take a blood sample to see how their samples had either increased after the exercise or decreased. And so in the results, in terms of weight gain or weight loss, there was no significant weight loss, and that's because the study was only done over 7 days, and it was moderate exercise. They only had to exercise at, I believe, 50 to 60% of their VO2 max, and so weight loss was not really expected in this. But we did see a decreased trend in fasting plasma glucose concentration, decrease in basal HGP, and then in this graph we can see how the white graph is a pre-study and the post-study is the black graph or black line, and both of them increase, which is correlated to the sensitivity and responsiveness. And we want to increase in both sensitivity and responsiveness, so we can see that there was a positive increase in this study. And so the conclusion was that the sensitivity and responsiveness were a major contributor to improvement in insulin action in patients with type 2 diabetes. Once most of the glucose was removed from the blood in response to insulin, it's taken up by the skeletal muscle and used during exercise-induced adaptations by the muscles. And another thing from the study was that after 3 or 4 days, most of the patients went back to their original metabolic states. And so it also kind of shows that it's kind of a use it or lose it. And so it's beneficial to have exercise, even if it's at low, moderate intensities. And now we're going to finish out with the conclusion.
All right, so I'll be speaking about the limitations. So the limitations for study 1, the Latino community was targeted, and it was specifically the older adults in the Latino community. A thing that we could get from that study, maybe more research could be needed to determine optimal intensity of resistance training resulting in maximal benefit and also ensure safety. For study 2, the community that was targeted was only males. It was a limited age range. Small amount of subjects were studied. In the study, they were told not to make any nutritional changes, but as they were said this, they weren't really checked on. So if they changed anything in their nutrition, it wouldn't be a big deal because it was not checked on. Study 3, a small amount of subjects were studied. So the group that was studied was basically focused on. There wasn't anything out of that group that needed to be checked, and that's what they went with. So the conclusion for the whole PowerPoint, type 2 diabetes is the most common form of diabetes. How can type 2 diabetes be managed? It can be managed by exercise, regular daily activity. Aerobic exercise and resistance training can help manage type 2 diabetes. In the studies, evidence showed that those who participated in controlled studies had a higher outcome in the results than those who did not. Other than exercise, what are other ways that you could type 2 diabetes could be managed? Healthy diet, watching what you eat, watching what you put in your mouth. Regular doctor visits. Just because you haven't been diagnosed with type 2 diabetes doesn't mean that you need to go to the doctor and check. If you have a family history, it's always good to go and do your daily visits with your own doctor and to see if something comes up, or if you already have it, what medications you can take. And the third one, medication. Take medication as needed. So if you've been prescribed by your doctor, take the medication, and it'll surely help you with managing type 2 diabetes. And so take-home message. So I wanted to put preventative measures. Know your family history. It's always good to ask questions of anybody that has gone through type 2 diabetes or any other diseases or sickness that has happened in your family. Healthier diet, like I said before, it's a good idea to see what you put in your mouth. Don't the 7 days of the week, don't try to eat burgers each day. Have a salad, mix it in with something. Drink a lot of water, drink Gatorade, build up back your electrolytes. Incorporate daily exercise. For example, I'm a soccer player. My family does go through type 2 diabetes. So I do tend to exercise daily, or that's have games twice a week, or that's go out for a run. It's always good to be prepared and have a healthy lifestyle. So another important thing would be monitoring blood sugar levels. Like I said before, going to the doctor is a good idea, but just because you go to the doctor doesn't mean that you can't do things on your own. It's very important to take care of your own body. And if you go to the doctor, take prescribed medicine. Just because you're doing exercise doesn't mean that it's necessarily enough to managing type 2 diabetes. If there's medicine provided, it's provided you for a reason, and you should be taking it when prescribed. That is the end of the presentation.